Hello, this is Matt Hedrick with the West Virginia Coalition to End Homelessness, and brief instructional video will walk you through some changes to the HMIS workflow in Service Point in response to the coronavirus or COVID-19. This primarily is for emergency shelters and outreach staff throughout the balance of state COC, and some modifications that are happening to your HMIS workflow so that you can track coronavirus or COVID-19 client symptoms or status for your clients that you're serving. If you like additional information about resources for COVID-19, please reference the West Virginia Coalition Homelessness Quick List documents that are created for emergency shelters, outreach workers, and the community at large. These can be found on our website, wvceh.org, under News and Updates. On these documents, we reference screening for COVID-19 symptoms and tracking the screening in the Homeless Management Information System if you are a shelter that is on HMIS. So to do that, there's some modifications that have to happen to your workflow, and a separate provider has been set up for tracking this information within the system. We've already reached out to project directors and executive directors at various agencies that have street outreach projects or emergency shelter projects, and they're going to be notifying us of those users in HMIS that will need access to this. So just because you're an HMIS user doesn't mean that you necessarily will have access to this provider. But if you do, and you're going to be the ones for your agency tracking this information, this video is for you. So to get into the provider that tracks COVID-19 information, we're here in our dashboard within the system. We're going to go into Enter Data As mode up here in the upper right-hand side of our screen. And then we're going to search for our provider that will track this information. It is called BoS COVID-19 Information. It's provider 1948. And we just hit the green plus sign and go into the provider. Now, it is the intention of the HMIS staff that this information gets tracked first whenever you're tracking client information in HMIS. So if you're an emergency shelter and you're tracking someone through Shelter Point to check them into a bed within your shelter, you'll want to go into this provider first before you go into your shelter provider for Shelter Point purposes. Or if you're an outreach provider, before you go into your path provider through Enter Data As mode or your ESG outreach provider, you'll go into this provider first. And you'll go into this provider first and track the information concerning COVID-19. Then, once that information is gathered, then you'll go out of Enter Data As mode for this provider, go into Enter Data As mode as you normally would for your standard workflow to track your shelter activities. So gathering this information and tracking it in the system is relatively simple. You just go into the correct provider through Enter Data As mode, then go into Client Point, search for your client as you normally do. We have a test client here set up, so we'll just go into this client. And here in Client Point, for this provider, we only see one tab, this Assessments tab. But it has two components. It has the BoS COVID-19 client screening component, and then if we go to the drop down, the BoS COVID-19 current status. So the client screening component is the first one that defaults to. And this is what you do when you're screening clients as they come into your shelter, or you're screening them if you're providing outreach services to them. And it's just a collection of um, yes, no questions and determining how best to serve a client and protect both your client and your community and yourself when working in the new um, situations concerning COVID-19. This is just example screening questions that were programmed into the system that they're utilizing across the country right now. And it kind of walks you through the steps. So you screen clients for symptoms consistent with COVID-19, and you ask them when they present for services the following: are you experiencing symptoms consistent with COVID-19, fever, cough, shortness of breath? And however they answer that, yes or no. And then you have 3 questions here. Do you have a fever? Yes or no. Do you have a cough? Yes or no. Are you experiencing shortness of breath? Yes or no. And upon screening, if the client answers yes to questions 1 through 3, they should be masked or isolated. And based off of how your community is responding in terms of isolation of clients, either within your shelter or another isolation site, you would react accordingly. Next, you ask your client their age. And if the client answers yes to any questions 1 through 3, and are over the age of 55, they should be transported to the hospital or other testing site based off what's in your community for tested for COVID-19. Then your 5th question is, do you have any of the following: diabetes, heart disease, high blood pressure, lung disease, or any immune suppressant illness? Now, if the client answers yes to questions 1 through 3 and has any illness listed in 5, then again, they should be transported to the hospital or another testing site for testing for COVID-19. So then all we have to do then is save, and we've done our pre-screen, and based off of those answers, um, we'll determine what we need to do in terms of isolation, or in terms of masking, or in terms of testing for a client. Now, every time they present for services, we can ask these questions of them again, and we can react accordingly. Then the second component after the screening is the client's current status with COVID-19. So we just select that from the drop down here under select an assessment on this screen and hit submit. And we get a couple additional questions. Now, if we're working with an outreach client we've worked with before, or a client that we've worked with before through coordinated entry or whatever the case may be, this information may already be filled in. But by gathering this additional information about the COVID-19 crisis, both COCs and providers are able to determine an appropriate response as the situation develops. So it's important to gather this information, especially if you're working in outreach, the client's phone number, or an alternate phone number if that phone number might not work, or to a place they can leave a message. And also, on a regular day, what's the easiest way to find you, and what time of day is easiest to do so? It's important to gather that information when working with clients, especially now. Then here on the drop down, we have COVID-19 current status agency. So this essentially is which provider you work for, if you're the one collecting the status, who collected his last current, he or she's last current status. Now, with this too, if your agency happens not to be on this list, just let us know via the help desk, and we can add them to the list. Now we can answer here if appropriate. We can leave it blank for healthy clients, but since we answered this question accordingly on our screening, it still shows up as yes, or it might show up as no based off what we answered previously. If they do answer yes, then we can enter a date for all symptomatic clients. So if the client can't remember, we'll just enter today's date. Next, we'll enter a date of when they began isolation. If they went into isolation, that's not quarantine. That is just that they're isolated from other shelter guests, or if they were just under observation to see if their symptoms worsened, or if they were until they could get tested. And again, leave blank if this isn't applicable, or if they're not showing symptoms, or if it's unknown. Next, we enter a date if they did go into full quarantine for 14 days or whatever is determined by your community, your quarantine dates, your health department, or whatever the case may be. When did you begin your quarantine? And you put in that date accordingly. And if the client was hospitalized, if they were hospitalized for coronavirus or COVID-19, when were they hospitalized? When were they admitted to the hospital? And again, if they weren't, you leave that blank, or if it's unknown. There's also a drop down here for what was their test result if they were tested, and if they had confirmed disease status. So did they test positive or negative? And if they were tested, what date they were tested? And if they were tested, when the results were provided to them. So if they were tested on the 20th, but they didn't get their results back until the 25th, then we would record that date here. Then there's a drop down here for what is your current symptomatic disposition, meaning they're symptomatic, they're no longer symptomatic, they've confirmed recovery, or it's been their recovery's been confirmed, or deceased. And then we record the date of this current symptomatic disposition. So as of today, they're currently symptomatic. There's also a text area here where you can enter in any client health notes. Now, again, keep in mind that this is that you don't enter anything that's self-reported, anything that you want to enter, things that are just apropos to them staying in housing or concerning isolation or quarantine or COVID-19. You don't enter any kind of health notes that are related to anything else. And then here you can enter in the date that the client self-reports feeling better, or their recovery date. And then we can hit save. So just keep in mind there are the two different components to this these assessments. There's the screening assessment for when they present, so you know what kind of response to take with them, and then after they've been either screened or they've been in shelter and tested or whatever the case may be, then you can record their current status with COVID-19. So once we've saved and we have all our information saved for this, either at this time of presenting services or this outreach contact, then we can go up here back to enter data as mode and then go ahead as we normally would with our data entry for HMIS, either checking them into shelter. So like we went into Bartlett House, emergency triage shelter, or if we're doing outreach with the client, checking them into outreach based off of whatever providers we have access to. And then we just go through our standard HMIS workflow, either through shelter point or through client point. Now, again, if you're a project director or executive director and you haven't yet let us know which providers or which users at your agency will need access to this provider, please do so as soon as possible. And the HMIS team will assign those accordingly so we can get this information gathered. And we'd like to get this information gathered as soon as possible. As soon as you have access, start gathering this information for the folks you're doing outreach to or the folks that are residing or shelter guests within your shelter. And you can always, if you have any questions about this, of course, you can always contact us at the help desk, hmishelp at wvceh.org. And for additional information about COVID-19, you can you can visit the resource page on our website, or reach out to your local health department or DHHR. Thank you so much, and we really appreciate all your cooperation as we determine what to do as we move forward with tracking this situation, and any changes that might happen down the road. We appreciate that as well. So thanks again, and have a great day.